Selena Gomez just did an interview with Vanity Fair, which is so important. Not only does she open up about her battle with lupus, a chronic medical condition which can be very serious, which she's been very open about in prior years, but this is the first time that she's really talked about how her diagnosis may impact her family building plans. She said, "I haven't ever said this, but I unfortunately can't carry my own children. I have a lot of medical issues that would put my life and the baby's life in jeopardy. And that was something I had to grieve for a while, but I'm in a much better place with that. I find it a blessing that there are wonderful people willing to do surrogacy or adoption, which are both huge possibilities for me." Of course, there are many different reasons why someone may consider using a gestational carrier or a surrogate. And a lot of times we focus on issues like failed implantation and trying to work around different causes of infertility. But I want to talk specifically about this type of scenario where surrogacy can provide an option to allow a patient an avenue to have a pregnancy safely and to maximize not only their health, but the health of their future baby. So here are some common reasons or examples of medical reasons to advise a patient to consider gestational surrogacy or a gestational carrier. Number one is severe heart disease. Patients with conditions like a congenital heart defect, cardiomyopathy, or a history of heart failure, they can be at really high risk of dangerous complications because of the increased strain that pregnancy can put on the cardiovascular system. Kidney disease is another example. Chronic kidney failure, issues like this can worsen during pregnancy because of the increased demand that pregnancy can place on the kidneys. And this can put both the person carrying the pregnancy and the developing fetus at risk. Another example of a medical problem that might warrant surrogacy is uncontrolled diabetes. Whether it's because the patient is not able to be compliant with the necessary treatment or they have really hard to control diabetes, this can lead to really serious complications such as preeclampsia, stillbirth, or preterm delivery. So this is a reason why you might be told to consider surrogacy as an alternative. History of having severe preeclampsia or eclampsia in a prior pregnancy, especially if it was early in onset. These are the patients that are at a very high risk of recurrence, and it may be deemed appropriate for them to consider surrogacy moving forward to lower their risk. Another major example of medical conditions that can warrant surrogacy are autoimmune conditions, especially conditions like lupus or antiphospholipid syndrome. This is what Selena Gomez had. She has lupus, and this can be associated with recurrent miscarriages, preterm birth, and severe illness, depending on what organ systems are affected. Additionally, some patients have uterine abnormalities, structural issues like fibroids that can't be fixed with surgery, or scar tissue called Asherman syndrome, or even uterine malformations where the uterus could be bicornuate or unicornuate. This can make it difficult or impossible to carry a pregnancy to term, in which case it may make sense to move on to surrogacy. And then for patients who have a history of cancer, maybe they've undergone different types of treatments such as chemotherapy, radiation, or surgery. It could have impacted the uterus or overall reproductive system, and they may be told that they're at an increased risk of cancer recurrence if they do get pregnant. So they may seek out surrogacy as their next best option. And then for patients with severe pulmonary hypertension, this is an issue where you have high blood pressure in the blood vessels that are associated with the lungs. And this can be life-threatening if someone gets pregnant with this condition because of the increased demand of pregnancy on both the heart and the lungs. And then a less common indication is for someone who's had many prior C-sections. There may be a higher risk of uterine rupture or other pregnancy-related complications, especially involving the placenta and where it implants, and this may make surrogacy a safer option. These are just a few of many of the scenarios or examples that we encounter as REIs on a day-to-day basis where patients come to us to talk about their chronic medical conditions and whether it would be safe for them to carry. But the important thing is to understand that there are options, and it's always a great idea to loop in a high-risk obstetrician for a preconception counseling visit to get their take on what the risk of complications are if you do become pregnant and whether it makes sense to consider alternatives like a gestational carrier.